If you are looking for relief from vertigo and the dizziness and the nausea and just the absolute disruption to your normal day life, today I'm going to share with you 7 natural ways to treat vertigo so that you have a totally different experience. And many of these tips can completely eradicate the situation. So if you need relief now, let's dig into today's video. It's not uncommon that I have patients in my practice booking virtual appointments to figure out ways to treat vertigo. And I'm going to share with you my best resources and tips for them that you can use and deploy at home. As a naturopath, these are a lot different than the normal prescribed medications. They're addressing the root cause, from the displacement of crystals to inflammation, swelling, and they also address triggers that can exacerbate vertigo and even cause vertigo. One of the most powerful resources, number 1, is called the Epley Maneuver. This is a simple technique that a lot of vestibular disorder specialists perform in a clinical practice. Think of this particular maneuver as a PT for your inner ear. This particular technique is a way of changing the placement of these displaced crystals and getting them back into where they need to be so that we can alleviate the symptoms. A lot of times this simple technique is performed over a series of appointments, and once the crystals go back in place, you're all good, problem solved. So to find a specialist in your area that does the Epley Maneuver, search via Google vestibular disorder Epley Maneuver in my area. You're gonna find multiple clinicians that are trained in this particular specialization. It's not always going to be an ear specialist. I've referred to PTs, ear doctors, and even surgical offices that perform this maneuver. So it's a specialization that definitely you want to search for and is highly effective. Similar to the Epley Maneuver is number 2, the Brandt-Daroff. These are exercises particularly aimed at folks who have the diagnosis of BPPV. BPPV stands for Benign Paroxysmal Positional Vertigo. So these exercises you can do at home, and they function like this. You're gonna sit upright, ideally on a couch or a bed, and then very quickly you're gonna lie down on one side. And you're gonna hold that position for a total of 30 seconds. And then you return to an upright seated position. And then you repeat to the other side. I recommend starting with the right side and then transitioning to the left side. And often you'll do this several times throughout the day. So 3 to 5 times a day for a course of 4 to 6 weeks. What this is targeting is that kind of recalculation of the brain and your positioning, so that the brain and the ear is registering that you are upright and helps stabilize the sense of vertigo. It's a little bit of a different technique, and it is only effective for folks that have BPPV. So if you have crystals, that's not going to put the crystals in place. Now 3rd, and I love this recommendation, is ginger. Ginger is a powerful anti-inflammatory. Not only does it address the symptoms of nausea and even extreme vomiting that can occur with vertigo, but it also will help eliminate the swelling and the fluid retention in the inner and middle ear, and overall is going to help decongest the whole entire ear, nose, and throat passageways, which helps to reduce overall head and neck inflammation, lowering the symptoms of vertigo or the pressure that's being placed here in your balance. The 4th recommendation is actually a deficiency that scientifically we can see connected to an assortment of vestibular imbalances and vestibular disorders like vertigo. And generally, sadly, I hate to admit this, but a lot of doctors are not testing you for a vitamin D3 deficiency. Overall, what you want to do is be at an 84 to 110 on your vitamin D3 levels. Many of my vertigo patients, when we test their D3 levels, they're in the single digits and sometimes the 20s and 30s. That is not high enough of a D3 value to support the musculature structure of the ear. Vitamin D3 has a very unique role to play in our muscle structures and supports and enhances our muscle strength in our body. And when it comes to this particular deficiency, not only do we see immune imbalances, but we also see a weakness in terms of the capacity for the ear to be strong and supple and to hold in the crystals and to also register the right proper balance. So across the board, regardless of what form of vertigo you experience, having your vitamin D3 levels tested is critical. If you're interested in an at-home test kit where you do a blood spot, we have those here in my clinic, and I'll post a link down below. And I also have a free guide. If you're curious about where your levels are, if you have that test and you know where your vitamin D levels are, what type of dosing requirement do you need based on where your levels are currently, and how long it's going to take for you to maximize or optimize into that ideal optimal range. This vitamin D dosing guide is free, and there's a link in the description box below where you can grab that. Number 5, I recommend hydrating with minerals. Obviously, dehydration is not good for any of our mucosal passageway or moving fluid in our body, including within our ear. But we want to take advantage of hydration with minerals, particularly a magnesium-forward mineral, liquid mineral that you can add to your water or juices you drink throughout the day. Dehydration will enhance the symptoms, it'll make the symptoms worse. And so when we add magnesium to your hydration, magnesium reduces excesses of fluid in our ear. I have a whole bunch of information about ear health. I have a whole playlist here on YouTube, and I also have an extensive ear health masterclass, and magnesium is front and center in that masterclass with a whole bunch of other resources, remedies. So if you're interested in taking that, there will be a link down below. But magnesium is a powerful resource that you need to use every day in your arsenal to help support the reduction of fluid and the retention of fluid that can trigger the vertigo. It's often vertigo is going to be triggered by an accumulation of fluid in the middle and inner ear. Now, 6 is related to a hormone that your body is producing in response to stress. Cortisol, the stress hormone in your body, it can not only trigger, but can exacerbate vertigo. So stress management techniques, yoga, disconnecting, saying no more frequently, and reducing your cortisol levels are going to be critical. If you're not sure what your cortisol levels are, you want to get those tested. You can test those through saliva, and we have those test kits here in my clinic. They're at home test kits we mail to you, you take them and you send them to the lab and you get the results, and then I review those with my patients. I will post in the description box below a cortisol reducing, kind of a blocking compound. There are 2 trademarked plant barks that are very powerful at reducing cortisol. A lot of times my vertigo patients just don't have the time frame to wait for a test, so we need to address this immediately. And you always want to have cortisol reducers on hand so that you can take them at that onset and help minimize that inflammatory effect that cortisol, the stress hormone, has on your body. Now, if you're looking for other stress management techniques or tips and even DIY practices, body care practices, I'm going to invite you to take my free mini stress relief course. I have a whole course. It's short, it's 26 or 28 minutes, 3 modules, video content, and very impactful DIY resources that are free and that you can do anytime during the day to help reduce cortisol and lower your central nervous system overwhelm. And last and final is really addressing your diet and changing or modifying your diet in a way that is anti-inflammatory and lowering the triggers. Sometimes for some patients, triggers might be related to food-oriented allergies or food sensitivities. They might be triggered by histamine release within the body. Vertigo might be triggered by high levels of sodium, sometimes preservatives, things like nitrates and nitrites, and even inflammatory factors from fast foods and processed foods and sugars, particularly caffeine, alcohol, and artificial sweeteners are things you definitely want to avoid. So making a switch to eating a more dense, plant-based, dense, rainbow-colored variety of food throughout the day is what I recommend. Making sure that you also include functional mushrooms in that mix. So these, friends, are 7 ways for you to naturally address vertigo, to limit its effect, to limit and reduce the symptoms, and in many cases to completely eradicate that condition. I'm really excited to share this video with you because I know we can change so many lives and completely restore your quality of life. And that's our mission here at Natural Health Resources. So thanks for tuning in. Make sure you peruse the description box below where you can grab a lot of these resources and the free downloads and free course, and even register and enroll in my ear masterclass. So I can't wait to see you on the other side if you choose to participate in any of those programs or even download my ear health guide. So I look forward to seeing you on our next video. Make sure you hit that like button and subscribe and share this video if it inspired you and has healed you in any way. I look forward to seeing you on our next video.